CCHT Practice Test 2026 Certified Clinical Hemodialysis Technician 25 questions. Question 1. What is the primary function of the dialyzer? To pump blood, to act as an artificial kidney and filter waste, to warm the dialysate, to measure the patient's weight. The dialyzer is the filter where waste removal occurs. Question 2. Which of the following is a sign of disequilibrium syndrome? High blood pressure, nausea, vomiting, and headache, leg cramps, increased appetite. This occurs due to rapid removal of urea, causing brain swelling. Question 3. The movement of fluid from an area of higher pressure to lower pressure is diffusion, osmosis, ultrafiltration, convection. Ultrafiltration is the pressure-driven removal of fluid during dialysis. Question 4. Which access type is considered the gold standard for long-term dialysis? AV graft, CVC, catheter, AV fistula, portacath. Fistulas have the lowest infection rates and longest patency. Question 5. A technician should always listen for a bruit and feel for a thrill over which site? The heart, the lungs, the vascular access, fistula/graft, the carotid artery. These indicate that the access is patent and flowing correctly. Question 6. Which electrolyte is most dangerous if levels are too high in a dialysis patient? Sodium, calcium, potassium, magnesium. Hyperkalemia can cause fatal cardiac arrhythmias. Question 7. What is the purpose of priming the extracorporeal circuit? To cool the machine, to remove air and manufacturing residues from the lines, to check the patient's blood type, to save time. Priming with saline ensures the circuit is safe for blood contact. Question 8. During dialysis, a patient's blood pressure drops significantly. What is the first action? Increase the pump speed, place the patient in Trendelenburg and give saline bolus. Stop the treatment immediately. Give the patient a glass of water. Hypotension is usually treated by improving venous return and giving fluid. Question 9. The term dry weight refers to the patient's weight after a large meal, the patient's weight without excess fluid, the weight of the dialysis machine, the weight of the dialyzer alone. Dry weight is the target weight where the patient is normotensive and edema-free. Question 10. What does KT/V measure? The patient's heart rate, the adequacy or dose of the dialysis treatment, the amount of protein in the diet, the speed of the blood pump. KT/V is a calculation of urea clearance over time. Question 11. Which of the following can cause hemolysis, rupture of RBCs, during dialysis? Correct dialysate temperature, high concentration of disinfectants in the water, low blood pump speed, using a new dialyzer. Chemicals or overheating the dialysate can cause life-threatening hemolysis. Question 12. Steal syndrome in a dialysis access refers to the machine stealing too much fluid, ischemia in the hand because the access diverts too much blood, a patient stealing supplies, using another patient's machine. The fistula steals blood away from the distal extremity, fingers/hand. Question 13. Which medication is commonly given during dialysis to prevent clotting in the circuit? Aspirin, heparin, warfarin, insulin. Heparin is the most common anticoagulant used in the extracorporeal circuit. Question 14. Water used for dialysis must be treated to meet standards set by NASA, AAMI, the Department of Energy, the local water company. AAMI, Association for the Advancement of Medical Instrumentation, sets water quality standards. Question 15. A t-test for water quality in a dialysis center checks for chlorine and chloramines, hardness, bacteria, temperature. Chloramines are toxic to patients and must be removed from the water. Question 16. What is the correct needle insertion angle for a mature AV fistula? 5 to 10 degrees, 20 to 35 degrees, 90 degrees, 15 degrees. Standard practice for a fistula is typically 20 to 35 degrees. Question 17. Which of the following is an example of an inbound complication? Machine power failure, patient falls in the lobby, inaccurate dry weight, all of the above. These are all issues technicians must monitor and manage. Question 18. Dialysate is composed of purified water, bicarbonate and acid concentrate, whole blood and saline, sterile water and sugar, bleach and water. The mixture is precisely controlled by the machine. Question 19. The brute heard over an access site should sound like a sharp clicking, a continuous whooshing sound, silence, a muffled drum. The whoosh indicates turbulent, high-velocity blood flow. Question 20. Post-dialysis, when should the patient's weight be taken? Before the needles are removed, after the needles are removed and bleeding has stopped, the next morning, whenever the patient feels like it. The post-weight confirms how much fluid was actually removed during the session.